If you have ever looked down at your hands and thought your nails were just there, just growing, just being nails, you are missing one of the most revealing diagnostic windows your body has. A study published in the American Journal of Clinical Dermatology confirmed what dermatologists have quietly known for decades. Your nails are not cosmetic. They are biological broadcast systems, transmitting signals about your heart, your lungs, your liver, your thyroid, and your blood, right there on the tips of your fingers. Before we go any further, if you want to understand your body at a level most people never reach, subscribe to the Health Lab right now. We publish videos that translate real science into knowledge you can actually use. Now, your nails may be trying to save your life, and in the next few minutes, I will break down what the color changes mean, what the shapes are warning you about, and what the surface texture of your nails is quietly screaming at your doctor. Here is the mechanism you need to understand first. Think of your nails like a monthly report card printed by your body's internal systems. Your nail plate grows roughly 3 millimeters per month, which means the nail you are looking at right now is essentially a timeline, a biological archive of everything that has been happening inside you over the past 3 to 6 months. Every nutrient deficiency, every circulatory disruption, every inflammatory event leaves a mark, a line, a dent, a color shift, baked right into the keratin as it hardened. Your nail is like a geological core sample. The deeper you look, the further back the story goes. This is why dermatologists and internists examine nails during physical assessments. They are not being thorough for the sake of it. They are reading a document your body wrote in real time. The first thing to examine is color. Specifically, what happens when the normal pinkish hue you expect starts. Healthy nails are pink because the rich capillary bed beneath the translucent nail plate is doing its job, delivering oxygenated blood close to the surface. When that color goes pale or white, particularly in the lower two-thirds of the nail, while a narrow pink strip remains at the tip, you are looking at what clinicians call Terry's nails. Research has associated this pattern with liver cirrhosis, congestive heart failure, and type 2 diabetes. The mechanism is vascular. Reduced blood flow to the nail bed, combined with connective tissue changes beneath the plate, creates that washed-out appearance. But here is the twisted irony. Terry's nails can appear even when someone feels perfectly fine, years before a formal diagnosis. Your nails are ahead of your symptoms. Blue or purple tinting at the nail bed is a different alarm entirely. This signals cyanosis, a state where hemoglobin in your capillaries is carrying less oxygen than. The American Heart Association lists nail bed cyanosis as a visual indicator worth investigating for underlying pulmonary or cardiac dysfunction. Your nails are turning blue because your blood is essentially running low on what it is designed to carry. That is not a cosmetic issue. That is your cardiovascular system waving a flag. Now look at the shape, specifically the angle where your nail meets the finger. Normally that angle is less than 160 degrees. When nails begin to curve downward over the fingertip, rounding out like the back of a spoon pressed upside down into clay, you are looking at clubbing. Clubbing develops because of chronic low oxygen delivery to the peripheral tissues, which triggers local growth factors to thicken the soft tissue beneath the nail. It is slow, often painless, and strongly associated with pulmonary fibrosis, lung cancer, and congenital heart defects. A large cohort study published in a major respiratory medicine journal found that clubbing was present in a significant portion of lung cancer patients at the time of diagnosis. Your doctor checks for this. You should too. The opposite shape, a nail that curves upward at the edges like a spoon, is called koilonychia, and it tells a completely different story. Here, the culprit is usually iron deficiency anemia. Without adequate iron, your red blood cells cannot produce sufficient hemoglobin, and the nail matrix, starved of oxygen and nutrients, begins to deform. The nail loses its structural integrity and flattens, then cups. The biological term here is hypochromic microcytic anemia, and koilonychia is often one of its earliest visible signs. Your nails scooped before your fatigue became undeniable. Now look at the surface. Smooth, slightly shiny nails are the biological baseline. When you start seeing horizontal dents running across the nail, those are called Beau's lines, named after the French physician Joseph-Honoré Simon Beau, who first described them in 1846. These lines form because a systemic illness, a high fever, major surgery, severe emotional shock, or even a prolonged crash diet temporarily halts nail growth. When growth resumes, that pause is recorded as a visible groove across the plate. You can actually estimate when the stressor occurred by measuring how far the line sits from the cuticle, since nails grow at that predictable rate of 3 millimeters per month. Beau's lines are your nails keeping a diary. Pitting is different. Small, shallow ice pick-like depressions scattered across the nail surface are strongly associated with psoriasis, a condition where the immune system accelerates skin cell turnover at the level of the nail. Studies suggest that up to 80% of people with psoriatic arthritis will show nail pitting at some point. The pits form because clusters of abnormal cells are shed from the surface of the nail as it grows, leaving tiny craters behind. If you see pitting alongside joint pain or scaly skin patches, your body is pointing you toward an autoimmune process that deserves clinical attention. Then there are the lines that run the other direction. Vertical ridges, those fine parallel lines running from cuticle to tip, are largely a normal part of aging. The nail matrix thins, oil production decreases, and the plate grows less uniformly. Nothing alarming there. But dark vertical streaks, especially brown or black bands that appear suddenly in a single nail, are a different matter entirely. A dark longitudinal streak, particularly in someone with darker skin, can represent koilonychia, which is sometimes benign but can, in rare cases, signal subungual melanoma. Dermatologists use the ABCDEF rule for nail melanoma assessment. Asymmetry, band color irregularity, change over time, diameter greater than 3 millimeters, extension beyond the nail fold, and family history. One dark line that was not there before is worth showing to a doctor. Full stop. So what do you do with all of this? Start by looking at your nails in natural light, not under a phone screen, not after polish. Look at the color of the nail bed. Press gently on the tip and watch how quickly the pink returns when you release. Slow refill can indicate circulation issues. Look at the angle of the nail as it leaves the finger. Look at the surface for horizontal grooves, pitting, or new dark streaks. Notice changes that persist beyond 2 to 3 weeks. Take a photo monthly if you are monitoring something specific. And tell your doctor what you see. Bring the photograph. Nail findings in a clinical context add information that blood panels sometimes. Your nails are not decoration. They are documentation. Every shift in color, every change in shape, every line and groove is your biology keeping records that your conscious mind is too distracted to notice. The body does not lie. It just speaks in a language most people never learned to read. Now you are learning. The question is whether you will pay attention next time you glance down at your hands. Drop a comment below and tell us, have you ever noticed an unusual change in your nails? We read every single one, and if this video gave you something useful, subscribe to the Health Lab. Your body has more to say, and we will be here to translate it. The body has more to say, and we will be here to translate it.